I want to bring in Dr. Michael Feiz right now. He's a bariatric surgeon. He deals with Ozempic. He's seeing patients who are on this drug. So, Doc, thank you very much for taking time out of your practice to do this. One, have you heard anything like what Emily's telling us right now?
First, Chris, thank you for having me on the show. I appreciate that. And yes, it is not uncommon to have gastroparesis. It's about 2% of the population that struggles with it. Many of them have it without being diagnosed. And as she mentioned, it is common to get it from diabetes as the most common cause of it. However, it's not a good idea to be on Ozempic when you have gastroparesis. It just exacerbates the situation. Ozempic is meant to slow down the intestinal tract. That's how it works. And all semaglutides, as well as Mounjaro and trizipatides, their main goal of function is to slow down the intestinal tract. It's not treating diabetes per se. It is treating type 2 diabetes by causing weight loss. It's not a bad medication. The problem is that it is being overprescribed, and oftentimes being overprescribed by physicians that don't quite understand the gastrointestinal tract. In my practice, we do a very thorough workup before we prescribe these medications, and people who have constant or common constipation and or vomiting, we feel are not good candidates because semaglutides and trizipatides, Ozempic, Wegovy, are going to exacerbate the situation. And it could
So
lead
help me understand it from the layman's perspective. Are you saying that there is a sensitivity in a certain percentage of the population, diabetic or non, maybe even more so if diabetic, that Emily either does or does not fall into? She says her diabetes didn't cause her motility issue, but, you know, let's just put it out there as a concept. And not that Ozempic as a drug causes something like paralysis of the stomach. What exactly are you saying, doctor?
I'm saying exactly that. We just don't know. As she mentioned, it's still a very new medication. We don't have long-term studies. And you raised a very good point with comparing it to fen-phen. Back in the day when they studied fen-phen, they had a small population of sample population that they were testing it on. When they started prescribing it and when it went viral, it went and was prescribed to tons of people. For example, these medications, just in the last 6 months or the last year, over 5 million prescriptions have been written for people who don't have diabetes. It does work. It is a good medication. But if the patients aren't being followed, if the right questions aren't being asked, then this could get into a situation where you struggle and have irreversible problems like gastroparesis. So yes, there is a there is an instance of people who have it. It's a predisposition to having constipation or gastroparesis. These are not the people that should be maintained on Ozempic. The fact that she was vomiting continuously and she wasn't warned or at least stopped with the medication, I can't explain that. It's like creating a medical bulimic.
Right, that bothers me too. Emily, I'm sure this is something you've been thinking about for a long time. Is there anything the doctor has said that is different than what you've heard or that raises a question for you that you want to ask?
No, I think what the doctor is saying, again, in 2018, when I started this medication, this information wasn't disclosed to me. This was just a new fantastic drug that is supposed to do wonders for my diabetes, and that, I would be silly not to jump on the bandwagon and give it a go, especially as somebody who was young and just diagnosed with diabetes. And so I thought it was going to change my life. And in fact, it did. It changed my life to the point where I can't work anymore. And that's the saddest part about it. It's great. I've lost so much weight. I think I look fantastic on the photo. I can't believe that's me. But at what cost? And I think that's the biggest part that, again, to people listening, is if you are vomiting all the time and you're nauseous or you're struggling between constipation, diarrhea, bloating, SIBO, and you're getting, sulfur smelling burps that smell like rotten egg and everyone's disgusted by the smell, there's a problem. It's not normal, and you do need to speak up. But even if I spoke up to the doctors, it was, but your A1C is 6.1. You're doing great. Give it a little bit longer. The side effects should go away. But, they didn't.
Hey, thank you for watching. please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.